The Health Ombudsman has found that 2 nurses at Motherwell Clinic in the Eastern Cape failed to provide health care to teenager Zenizole Vena, I beg your pardon. The 15-year-old girl was kidnapped and gang raped back in September of 2022 when she went to the clinic and was turned away and told to go to the police station. However, she died a short while later. The investigations found that the teenager waited for a long time to get help at the Motherwell police station before she died. The Ombudsman has referred the nurses to the South African Nursing Council to investigate their conduct. For more on this investigation, let's bring in the Health Ombudsman, Professor Taole Mokoena, who joins us via our video link this morning. Prof, it's great to have you on the program. Thanks very much indeed for making time. We now know through the findings that you presented to the media yesterday that these 2 nurses at this clinic didn't do what was expected of them. The question that comes up is, what ought they have done?
Good morning, Ayanda, and good morning to your viewers. Actually, it is not that what more could they have done. They simply did not do anything. If they had attended to the child, they would have seen that the child needed help. More than anything, just simply to support the child with fluids and also instead of sending the child to the police station, they could have sent the child to the next level of care, which is a hospital.
Right.
Indeed, in PE, there's Doranginza, which is a hospital that has got a specific facility to attend to rape victims. So that's what they should have done.
Sure. It's absolutely heartbreaking that this teenager eventually died. And among the questions that will come up from this is, what kind of culpability should these nurses actually face for that fatality? I mean, can we draw links to their lack of care and, you know, what actually happened? The teenager sadly losing her life.
Well, I think the culpability is outside our province. However, the law enforcement people can look to that. From a healthcare professional point of view, it's not actually capability. It's just wanton negligence in that they simply did not attend to the child. And for that, then the regulatory, health regulatory bodies, in this case a nursing council, should deal with them and give them the censure that they deserve. And the censure, I wouldn't talk for the nursing council, but it could be either they get deregistered or suspended, or cautioned, or asked to go for retraining. But that's for the Nursing Council to determine. I would doubt that there would be a criminal culpability in the sense that they did not commit anything. Rather, they neglected their professional duties.
That's interesting, because neglect to some people might be the action that has been taken, but I hear what you're saying about that not necessarily being your call to make. It's interesting that it's 2 nurses in particular that have been, if you like, isolated. I know that's not really the right term to use here, but help us think through how you came to finding specifically these 2 nurses essentially failed to do their jobs.
Well, it is those 2 nurses that failed to do their job because it was them and only them that were on duty at the clinic on the day at that time.
All right, fair enough. You know,
Yes.
your predecessor described the Eastern Cape Health Department as an embarrassment. It's a line I think that few of us will forget, given how bold the statement was. And I'm only mentioning this because I'm sure for many people, questions will arise around how many other instances where there is potentially, at the very least, neglect that costs people's lives in the Eastern Cape. In your asking questions around what's taking place, what have you possibly uncovered about what might be happening, generally speaking, in East London and in the Eastern Cape Health Department?
Well, the main issue in Port Elizabeth or Gqeberha as we know it today is that the Nelson Mandela district health and management system is not effective, firstly in training and guiding their profession, nurses in this case, and also supervising them to make sure that the professionals are carrying out the duties as they should. So the issue is not only with the nurses who are at the coalface, but also as management that are supposed to be guiding and supervising the professionals.
Yeah. In this particular instance, should the management that you speak of, at least in this particular hospital, have also, been involved in one way or the other? Would it be fair to bring them in when we ask questions around accountability here?
Well, we did bring them in the sense that it is in our recommendations that they should take charge of the system there, and maybe I should just go back a little bit, Ayanda. Is that there are norms and standards that are published that the institutions, in this case the Nelson Mandela District of Health, should be aware of and make sure that the healthcare professionals follow. And those operating standard operating procedures, they are not in place in the area. So it is our recommendation and direction that management must upload this and train the healthcare workers on these standard operation procedures and oversee them. Now, from your line of questioning, it suggests that we should be looking at punitive measures to the managers. Now, what I can tell you is that in that environment, there are no permanent managers; they are acting managers. So it's difficult to put to direct punitive measures to people who are in acting position, because firstly, what it is, they are acting, they are not necessarily responsible for the failure of the system in the manner that I have now described.
Right.
Because they're not running the system.
It's yet another instance that uncovers the multiplicity of the challenges we're facing in the Eastern Cape Health Department. Professor Taole Mokoena, thanks very much indeed for speaking to us. Appreciate your time. Professor Mokoena, of course, is the Health Ombudsman of South Africa.